Good day, I'm Dr. Kamanis and I'm a board certified plastic surgeon here in upstate New York. Today our topic is hand surgery. Sometimes it is unknown that plastic surgeons perform hand surgery, but we are well trained to do so. And here at Capillary Plastic Surgery, I perform a variety of hand surgeries from the most simple to the more complex, including trigger finger release, carpal tunnel surgery, and even more complicated trauma of tendons, nerves, and bone. So one of the most common types of hand surgeries that we perform is carpal tunnel surgery. Carpal tunnel syndrome, which is usually caused by a constriction of the median nerve, which is a major nerve that supplies sensation to the first three fingers of your thumb and the first two fingers of your hand, and also provides motor movement of the thumb moving across the hand, is constricted over time. Sometimes that's from repetitive nature at work, if you work with tools, or sometimes from typing, sewing. Surgeons get this, and it's called carpal tunnel syndrome. You know if you have carpal tunnel syndrome because you have usually aches and pains across the wrist, and sometimes tingling and numbness in the fingers. There's also a test called the Fallon's test that we do, where you flex your wrist down like this, and if it shows symptoms such as numbness and tingling, then you know you have carpal tunnel syndrome. There's also, you can tap on the nerve, and if the nerve shows electricity or you feel electric shocks, that is also positive for carpal tunnel syndrome. Carpal tunnel syndrome can be diagnosed definitively by EMGs, where they put electrodes into the forearm, and they shoot small electric shocks down the hand, which don't hurt. But what they do is they can tell us how fast the velocity of the shocks are going through the carpal tunnel. If it's slowed down at the carpal tunnel, that means that the carpal tunnel is diseased and constricted. So how do we remove or excise the carpal tunnel? Well, there's two ways: the open procedure and the endoscopic procedure, which is the minimally invasive procedure where we use a scope. I do it both ways. I start off with endoscopic procedure first, where we make a small incision here at the distal wrist crease, and the scope is introduced into there, and a small knife mechanism is engaged, and the carpal tunnel is cut. If the anatomy is unclear and the transverse fibers of the carpal tunnel ligament is not clear, then we convert the operation from a minimally invasive operation to an open procedure, which means you get an incision of approximately 1.5 inches along the palm in order to open up the carpal tunnel and release it. Carpal tunnel surgery has good success. It sometimes doesn't cure everybody, but it does have good success over time. Other hand surgeries that we perform are more complex here at Capillary Plastic Surgery, including release of the ulnar cubital tunnel, which is release of the nerves at the elbow, which is the ulnar nerve or the funny bone. And that's done with an incision, and the nerve is transposed or moved out of its little crevice or bone area here to reduce symptoms which are similar to carpal tunnel. Ulnar cubital syndrome is similar to carpal tunnel syndrome. More complex surgery that we perform is trauma from chainsaws or table saws, and the patient is brought to the emergency through the emergency department and into the operating room to repair bone, and the bone can be repaired with pinning or with plating systems, and also the tendons are put back together, and even nerves under microscopic evaluation. So that is the end of our discussion for hand surgery. A lot of the referrals happen from primary care physicians, but sometimes patients seek us out directly. If you'd like to learn more about hand surgery, or you have any of these issues, please feel free to contact us at www.capsny.com or at Capillary Plastic Surgery at 518-203-2593. We look forward to seeing you.